Hello everyone, welcome to Aussizz Conclave 2024. We hope that you are excited to know all about niche STEM, health, occupations, course and PR pathway. Our expo today, who will get you through your journey today. This section we have Miss Deepa and Miss Preeti. Miss Deepa is an international student recruitment specialist with over 10 years of experience in guiding students with course and careers. Miss Preeti serves as a director of Aussizz Group Journal, bringing extension experience and expertise to her role. Let's get started.
Thank you, Queena. Thank you for the lovely introduction. Welcome to our session on the niche STEM courses and PR pathway. Okay, what sort of niche STEM occupations and courses are we going to talk about? We are going to talk about lab medicine, we're going to talk about psychology, we're going to talk about occupational therapy, biotechnology, physiotherapy, speech pathology. So a lot of courses in the realm of allied health as well as in the field of health sciences and research is what we are going to delve into. So let's quickly dive right in. Lab medicine. Lab medicine is the science of pathology. Basically, after COVID, this occupation has really come into a lot of demand because this is about detecting and diagnosing diseases. So, post COVID, you can imagine that a study about diagnosing diseases from blood and bodily fluids and sample, it has come into prominence, and there is PR pathway for this course as well. Some of the popular lab medicine degrees include a Bachelor of Biomedical Sciences, Masters of Laboratory Medicine. Now, one thing you guys have to remember is that popular laboratory medicine degrees, now you can do these courses at a bachelor's level as well as at master's level. So some of the top university choices are mentioned there. RMIT, University of Tasmania, CQU, Charles Darwin University are very famous for these degrees. When students are going to choose about the laboratory medicine, one has to make sure that your degree is accredited by AIMS, Australian Institute of Medical Sciences. Now, if you do an unaccredited degree in this field, what happens is that you may not meet the skill assessment requirement or the registration requirement. You may have to then take a competitive exam to then meet the requirements. So to avoid all the hassles, please contact qualified education agents so that they can let you know what are the accredited courses that you can do. Now, as far as admission requirements are concerned, if you want to do this at a bachelor's level, only a year 12 is necessary. IELTS requirements are on the lower side, 6.5, no bands less than 6. But when you want to do this course at a master's level, then you need a cognate background. Now, the cognate background, which means the relevant background can be lab medicine, biomedical sciences, biological sciences. So basically, a background in anatomy and physiology is expected. Universities like RMIT also have GPA requirements, at least 2 out of 4 in GPA. English language requirements, again, as I said, even at master's level, only 6.5, no bands less than 6. Great scholarships are available as well, and 2 intakes a year in February and July. And this course is in the MLTSSL list. I'm sure Preeti will elaborate more on that and its PR pathway. So let's go on. Now, in terms of job opportunities, right, where can one find work? As I said, 70% of clinical decisions are based on reports from medical laboratory scientists, right? So the healthcare field is heavily reliant on medical laboratory scientists. So you can find jobs in health laboratories, hospitals, public and private sectors, forensics, also in universities and research sector as well. A brief on the salary. Now, one interesting thing about this medical laboratory scientist is 60% of the workforce are female. So females do prefer working in medical laboratory scientist occupations. And if you see the average salaries around at the start level is at $82,000, which is quite rewarding. And most of them work full time. And if the national average for full-time earnings per week is 1,600, whereas in terms of medical laboratory scientists, they earn up to $2,000 per week. So career-wise, the prospects are looking really good. Let's move on to the next one, psychology. If you are somebody who is interested in the study of human brain and behavior, as well as behavioral sciences, feelings and its methodologies, a career in psychology is the right one for you. Popular courses in terms of psychology, these are the pick of the universities that we have selected for you. Many universities do have this course, but one should make sure that, again, when you do any course in STEM and in niche health occupation, you must make sure that your course is accredited by the professional body. And in this case, is Australian Psychology Accreditation Council. And the most popular provider in this zone where the entry requirements are also a bit lenient is ACAP, Australian College of Applied Professions. Now, as far as admission requirements are concerned, at a bachelor's level, you must have IELTS 7 each, and you must have a year 12 in your home country. Now, is 7 each sounds too high? As I said, or ACAP, which is Australian College of Applied Professions, will has a 6.5 each requirement as well. At a master's level, the requirements are a bit stringent. There is a mature age entry for somebody to do a master's of psychology clinical or a master of professional psychology, which means you must be at least a minimum 21 years old. And they also check if you have if you have completed 4 years of undergraduate in psychology. So let's say you are from your home country, you have completed only a 3-year degree instead of a 4-year degree in psychology, then it will be difficult for you to get in. You may have to do a graduate diploma in psychology leading to masters. So do contact a qualified education consultants if you're looking at tracking the entry requirements for any of these courses, because what's in the gap matters. So because these courses are heavily competitive, because there's only one intake a year most often, except for Australian College of Applied Professions, which has 4 intake. The rest are all only one intake a year, and limited seats are available. So you must submit your suitability statement in terms of why you must be a psychologist, what interests you in this field. Plus, it is recommended that you submit professional recommendations from your professors if you're trying to crack the entry requirement at master's level. Scholarships are not too much in this profession because it's a very niche course. So scholarship opportunities are very much lesser compared to other streams of courses that we are going to discuss. As far as job market is concerned, immediately it doesn't look too good in the last 1 year, but in the next 5 years, there's a 27% hike expected in terms of job market. Now, all of these statistics are from Job Outlook website in Australia, and it is relevant as of this year. But what's interesting about psychologists is that the employment size is around 51,000, which is quite higher compared to the other occupation that we're going to discuss. So yes, the job prospect seems to be really healthy for people who are looking forward to careers in psychologists in Australia. In terms of industries that you can work, healthcare, social assistance, public sector, public administration and safety, as well as in corporate sectors as well, one can find job as psychologist. Next is about physiotherapy. Physiotherapy is the study of treatment of injuries, diseases, disorders through rehabilitation. The rehabilitation can include treatments, medication, surgery. Um, Popular courses in this realm, of course, Bachelor of Physiotherapy and Masters of Physiotherapy. We've mentioned a few choice universities there. Again, one has to make sure that the courses are accredited. You can go to AFRA's website and look at approved programs of study under physiotherapists to make sure that your courses meet the registration and licensing requirements, or you can contact a qualified education consultant who can help you pick out the course. As far as admission requirements are concerned, again, as I stress, these courses are seasonal. There's only one intake a year, limited seat availability, only 30 students a batch normally. So applications have to be personalized. You can't just submit your academics and English and hope to get a place to study. You will have to you will have to submit suitability statements as well as professional recommendations to consider you as a worthy candidate. Some universities also inculcate interview process so that you can meet the entry requirements, right? As far as when you want to study this course at a master's level, recency of practice requirements come in place. So your bachelor's degree must not be older than 10 years. And the bachelor's, you don't have to essentially have done a bachelor of physiotherapy per se to study masters, but what you have to do is you must still have the relevant cognate degree where you have studied at least 2 subjects in human anatomy or 2 subjects in human physiology so that you do understand what this course entails. Scholarships are available up to 25%, especially with University of Canberra. Remember, guys, because these are health professions, they carry really high IELTS requirement. 7 each, no bands less than 7 is the standard. And for PTE, that is overall 73, no bands less than 65. As far as physiotherapy careers are concerned, again, it has the greatest thriving job statistics compared to all the occupations that we are discussing today, up to 72% jump expected in the next 5 years. Um, and most work in healthcare and social assistance industry get jobs in NDIS especially. And we have specified the full-time earnings there. It's around 1,500 per week. Occupational therapy. Occupational therapy is kind of a allied health profession, but it is coming into prominence now. It's essentially a study where you help people participate in day-to-day activities by overcoming their disability or any sort of limitation. Occupational therapy, it is a course that is catching steam amongst international students as well, people who are tired of just doing nursing, teaching, or social work, which is, if it's not the pick of the courses, then occupational therapy is something that they can consider doing. Some of the prominent courses are available with Swinburne, Curtin, at bachelor's level are available with Australian Catholic University, CQ, CSU, etc. Again, your course must be accredited by AFRA before choosing, please be careful about that, be mindful about that, choose an accredited program. As far as job market analysis is concerned, it is the full-time earnings are around 1,569 per week, which is very healthy. And again, as far as the industries that you can work go, you can find work in healthcare, social assistance, public administration, and state, also in education and training in areas of OHS, right? This is data from Job Outlook, National Skills Victoria Council. You can see that there is a 69% increase in job availability in the next 5 years. That looks really promising as well. Now, as far as entry requirements go, of course, at a master's level, if you want to study this course, cognate background is necessary. A cognate background means any bachelor's degree in health sciences with specialization in um, anatomy, physiology units. If you have done, you must have done at least 2 units in anatomy and 2 units in physiology to meet the entry requirement. GPA wise, a minimum of 65% or 6.5 GPA is necessary. And IELTS requirement is 7 each or PT equivalent of equivalent score of 73, no bands less than 60, 68. Yes. Uh, Speech pathology. This is also something that is very popular amongst international students now who are looking to take, who don't find nursing or teaching or social work as the right fit. It is a study to become professionals who aid in speech ailments. Many universities are offering this degree at a bachelor's and master's level, and it is a very thriving career as well. Now, if you want to study this course at a master's level, you are expected to do a 4-week bridging program to get foundation level knowledge, especially in linguistics, phonetics. These can be sometimes entry requirements. And as far as speech pathology goes, the IELTS requirement is much higher compared to the other courses. It is at 7.5, no bands less than 7. So that is because you will be working in speech and language and linguistics. You are expected to know English at a very high superior level. Uh, Again, job market statistics, it is really high for speech pathologists. The average earnings about 1,827 per week, as well as there is a 90% increase expected in the next 5 years. This is National Employment of Audiologists and Speech Therapists data. Uh, Finally, biotechnology. I know many students do this course, especially from the subcontinent in India. It is amalgamation of natural sciences and engineering, putting the technology part in biology, so to speak. So you'll be studying about organism at a DNA level, at a microbiological level, and develop them into products and services. Popular courses include Bachelor of Science in Biotechnology as well as Masters in Biotechnology. Entry requirements are a bit more lenient compared to other courses. There's no requirement to be from a cognate background. per se, and the IELTS requirement is also 6.5, no band less than 6. But Preeti will talk more about its PR pathways and whether you would what you need to do post qualification so that you can be on the right course for the PR pathway. Popular careers include life scientists, biotechnologists, microbiologists, biochemist, and job market wise, see, this is a more research oriented field, so it's not the same as the others. Many people who finish a master's in biotechnology go on the PhD and the research route rather than entering the industry. So that is the logical academic pathway for most, and then they go on to do postdoc and become professors and university lecturers and work in research simultaneously. So that's it, guys, from my end in terms of courses and careers for these niche pathways. Now, Preeti here will take it forward and will give you the rundown on the skill assessment and PR pathway for all the occupations that we discussed now. Thank you.
Thank you, Deepa. Thank you so much. Hello, everyone, and welcome to this session. As I've been introduced as the migration agent, I would be talking about what's the residency pathways are. Deepa has already told you that what you need to do is for your students and being the studying. And the most important thing, which you all have to see, that it should be an accredited qualification if you are studying in Australia. Because like for example, I'll give you an example for masters in nursing. Sometimes people come to us and they say they have already completed its master nursing studies and we still cannot apply the permanent residency for them because unfortunately when they have done their qualification, it wasn't the accredited qualification, which is basically because all of these qualifications are a registered professions. They have to go through a registration process of their respective industry. And if they are, and those registration qualifications are already listed on their websites. So ensure, and as Deepa has said again and again and again, make sure you are doing a accredited qualification. And we cannot emphasize anything more than this one for your qualifications. Now, the careers which we will be talking about today is basically the laboratory scientist, the biotechnologist, the psychologist, physiotherapist, OT, and the speech pathologist. Now, for these ones, first main qualification for these, she has already talked to you about that, what those popular courses and the careers are. So I'm not going to take the time in those ones. We talk about what happens when you have finished your skills assessment. Sorry, what happened when you finished your qualifications? Let's say I've done any of those accredited qualifications. Then what next? Then the first step to apply for the permanent residency is a skills assessment. And every occupation has got their own assessment body to get their skills assessment. The easiest and the most easiest way is to get an assessment through the accredited qualification. Once it is done, it is easy. So we apply for a registration, we get the qualification registered, and we get an assessment, which is the first part of applying for your permanent residency. Now, one by one, I'll be taking up all the registry assessment bodies. The first one I will be talking about is the wet assess, which is basically this is the only assessment body where the accredited qualifications are not there. For example, if you're talking about a biotechnologist, if you're talking about a pharmacy technician, right, you are talking about a chemist, we do not have an accredited qualifications for those. Wet assess is because it is not considered into the STEM qualifications at that stage. They consider them into a general occupation, and they require you to have 1 year of an experience within last 5 years. So if an applicant comes here for a master's in biotechnology, have already completed a bachelor's in biotechnology from the home country, and now wanted to have a skills assessment, any 1 year experience which is obtained while in Australia or overseas will take you towards will get you a skills assessment. Majority, you have to, it should be within the last 5 years. Sometimes people come They complete their master's also, or they come for a second bachelor's degree. They hold their 485 visas, and when they come to me and we realize, oh no, your experience is now more than 5 years ago, and I need a 1 year within 5 years, which probably means when you come to me, it should be within the last 4 years. Because when we are applying, it should be 1 year within the last 5 years. So make sure if you have got a pharmacy, if somebody has done a pharmacy degree back home, but while studying, they were already working with the pharmacist and took a pharmacy technician uh, experience. Yes, you can go ahead with those ones, but their accreditation pathways are different for their careers. For the skills assessment, you can use those ones where it is a general, wet assess is the requirement. 20 hours per week is equivalent to a full time for the wet assess purposes. So that meets the requirement. Now, after that, I'm talking about now the next qualification is medical laboratory scientist. Now, with AIMS, when you do that qualification, you can get two skills assessments. One is the medical laboratory scientist, and the another one is medical laboratory technician. Okay. Now, for those ones, I will go in details about how we can get those because it is quite specific to what studies are you doing it. Accredited qualification, great. You don't have to look into the next slides. You're all good. You can look into the last slides where we'll be talking about how to get a residency. But if somebody has done a non-accredited qualification, or if the qualification is on the grounds that you have done those qualifications from overseas, then what is the pathway? Then your option 2 is if you haven't done the accredited qualification, we can go with an acceptable science degree and minimum 2 years of an medical pathology laboratory experience. It has to be the pathology experience, 2 years full-time or equivalent, which means if it's a part-time, you would need 4 years of an experience. The science degree that you are doing has to be, and then also it needs a written qualification examination. So it's a two-stage process when you go with skills assessment. Stage 1, you give them a documentation about your qualification and your experience. Once they say, yes, it is all good, it is matching their requirements and everything, then you sit for the exams. Now in the stage 1, what is the documentation process? They look into two types of units that you must have completed in your studies. All these accredited qualifications, they're already having everything what is required. I'm only talking about non-accredited or the overseas qualifications. So the basic subjects which you must have done is chemistry, statistics about the cells and tissue biology, biochemistry, microbiology, genetics, and molecular. So these basic units, they all are required that you must have done it. Out of the professional units, they need minimum 2 out of 3, or preferable is 3. And they are anatomical pathology, chemical pathology, genomic, hematology, immunopathology, medical microbiology, and transfusion science. So if you haven't done any of these professional units as a part of your qualification or your basic units, then your stage 1 will not be cleared. Even if you have got years and years of an experience, it will not be under this option. Okay, there's a separate option for those ones. And then, so as I talk about, then there's going to be the acceptable science degree, and you must hold and give the examinations onto that. Next slide is about medical laboratory scientist, where I said if you have not done, if your degrees were not the acceptable science degree, your basic units and your professional units were not matching, then what would happen? In those scenarios, then you must have, sorry, I'm on a wrong slide. Yes, this is the correct one, sorry. Then you must have got a postgraduate degree. If your bachelor's in science is not, your postgraduate degree is there, which is your master's degree and your 2 years of your experience. And you need to sit for a AIMS Medical Laboratory Scientist Specialist Professional Examination. This exam is a bit different to the stage 2, which is an option 2 degree, where you have already studied those ones. In this one, the requirement, because let's say that you have gotten years and years of your experience, you have not learned through your qualification, you have learned through your experience. So this experience, you will be telling them by passing these exams and minimum having a degree, acceptable science degree, which is basically a master's of science, a bachelor's of science or something, and a master's degree in a biological or a medical biological or a veterinary science. Okay. Then if you have done these 3 degrees, either of these ones, and then you sit for a laboratory specialist exam, then you can even clear the medical laboratory scientist skills assessment also. All right. Now, the next we'll talk about the medical laboratory technician. So as I told you, this AIMS qualification takes you towards a medical laboratory scientist, and the second one is the medical laboratory technician. Here they need. So we do not, let's say I do not qualify for the science degree. My experience is also not there. I do not have a master's degree also. Then you can apply for a technician. Here they talk about a qualification which is completed in a medical laboratory science, which is equivalent to our diploma. So the units which you have done sometimes are CEP, which is a country education profiles. Our degrees are not equivalent to an Australian bachelor's degree, and then they become equivalent to a diploma. In that scenarios, they would take you towards a medical laboratory technician, and you would need 2 years of a diagnostic medical pathology experience. So you need to be ensured that your experience, if you come and you say that you have worked in a laboratory for 2 years, part-time 4 years, or while studying here, you are working while doing your master's study in any other science, and you, because of your previous degree, you are doing that experience, you can get your skills assessment based on these ones also. So here the science degree, the basic units and the professional units is not generally what I've seen. If someone applies for a medical laboratory scientist and the degrees are not acceptable, they give them an option of a medical laboratory technician. They would tell them, okay, your qualification is matching. What you don't have is an experience. Go get 2 years of an experience and we can give you a skills assessment of a medical laboratory technician, which is again great. At least you would know where your pathways are. So if you have done your degrees, ensure you do not have an experience, do not wait for it. Get your degree and the qualification assessed. See whether this is leading towards your pathway or not. You don't want it to waste your 2 years and then realize your degree is not acceptable. You do not have those many years of an experience which will go with the specialist exams. Then what to do? Too late, right? So try to get your experience assessed. Okay. Then there is another pathway for medical laboratory technicians, which is a provisional registration, which is for the New Zealand, like somebody has got a New Zealand registrations, they are also accepted. You do not have to study or anything. You could probably go with the skills assessment straight away with a New Zealand qualification. Now I'll talk about the second one, which is the psychological. So I've finished about a medical laboratory scientist and a technician. The second one I'm talking about is Australian Psychological Society, APS. An accredited qualification obtained in Australia, great career. You will go for a skills assessment straight away. Don't have to worry much about it. But if you have not done an accredited qualification, then the pathway goes towards, and as I said, registration is must for applying for any skills assessment. So the registration pathway for a psychologist goes towards either as a 3-year of a sequence degree or a 4 years of a sequence degree, which basically means if I've done, which Deepa also mentioned, that you have done a 3 years of a psychologist degree, then you come here for a 4th and 5th year of a sequence program, and then you apply for a general registration, which this fourth and fifth year of a sequence program is basically 2 years of, you can consider is that the 2 years of a bachelor's degree. This is not a master's degree. They are not going to give you an admission into master's if you have done a 3 years of your bachelor's degree. Or you have completed a 4 years of your sequence degree, which is basically 4 years of your qualification in back home country, accessible to Australian qualification, then it can lead to a general registration straight away. Very rarely I've seen 4 years of a qualification, which is there in an overseas countries, mainly in Asian countries. Very rarely I've seen anybody has got those 4 year sequence program degree. Everyone has to do at least the 2 years one to get the skills assessment done further. This one needs basically minimum 6 years of a degree and 6 years of your qualification, equivalent to Australian studies. All right. If you do not have those ones, there is no way that your experience can substitute your qualification requirements. Qualification and the registration is must. You have got an ample number of years, 20 years of an experience. They may put you for a 1 year of your specialization to go under those ones, along with the supervised practice, and then you can go and get your skills assessment done. Psychologist, I would generally say, for me, it is one of the hardest one with a lot of degree and the education requirements, but a beautiful career. 5 years down the line, post-COVID, because of this mental health, organizational psychologist, and then there are the clinical ones and all. I mean, careers which is going up with the great heights at the moment and much needed in the society at the moment. Even my niece is also doing this. She has been saying that, do I really need to go? She only want to become a psychologist. I was like, yes, then you study for 6 years and go for it. And accredited qualification was my advice to her. And so is for you guys also. Now let's talk about this speech pathology in Australia. Again, the Hindi word of a Ramban is basically an accredited qualification that if you have finished that qualification in Australia from those ones, it's great. But if you have not, then overseas trained speech pathologist is one of the option to go ahead with the skills assessment. This option is basically you must have hold a membership from the MRA signatory associations, which is the Australia have got the membership signatories with different countries at the moment. And this is, we call it as an accredited pathway for the ones who have not studied from Australia, but their memberships and their qualifications have been under a signatory with Australia. So we have got a list of qualifications. You need to go onto the SPA, which is the Speech Pathology Australia website, and you could see the countries where the memberships are there and their qualifications. You need to have both. The membership from that country, you only if you have done the qualification, but you have not obtained a membership for that, then you are not eligible again. Then get a membership. Or if you have got a membership but not that accredited qualification, then again, you are not eligible. So you need to have both for an overseas trained speech pathologist. Now we talk about, let's say that you do not have any of these ones. What is the option 3? Then you would need to have 1,000 hours of an experience obtained within the last 5 years as a speech pathologist. Your English requirement efficiency needs to be higher, which is 7, which is basically in any other accredited qualifications also, that's a 7 each. And your qualification is comparable to the speech pathologist trained in Australia. It is not a membership qualification, which we were talking about, but it is equivalent to an Australian qualification. So basically a bachelor's degree obtained there, a bachelor's degree obtained here, with your first or a second division should be equivalent, a 3 years or a 4 years bachelor should be equivalent to an Australian bachelor's. Along with that, you would need a 1,000 hours of an experience obtained within the last 5 years and an English language requirement. They all, in every qualification, the English language requirements are the academic with minimum 7 in each. There's no one which is below the 7, and the registration body is not accepting those ones. And basically their reason is when you become a trained professional, you are going to see the people from every race and community and the organization, maybe in an Australian, maybe somewhere from else and all that. So they want your English language criteria to, and that's why they have set it quite higher, so that you are comfortable when you're diagnosing, when you're telling them anything, or you're receiving the instructions from your clients, right? So again, we gave you the 3 options, and for this one. And now we go with the physiotherapy. Physiotherapy, their accredited qualification, there's an approved plans of study. This is basically APC, Australian Physiotherapy Council. That again doesn't give many options. They just say that either you have done an approved program of a study. If you have not done an approved program which is accredited, which even have got few of the overseas qualification, if you don't have those, then you go with an equivalency of qualification. This is an option 2. You need to obtain a council certificate of substantial equivalence after successfully completing equivalence of qualification. So these qualifications are, you have done from home country, but you do not have any recent experiences and all that, then they would advise you to do some kind of a bridging in between, or some kind of additional units that you need to complete. And then they are going to provide you a council certificate of substantial equivalence. Because here, it doesn't matter how many experience you have it. They are only talking about a qualification here. In an accredited qualification, there are Australian qualifications, and there are few qualifications which are obtained from overseas also. But the ones which are not equivalent, you need to obtain a council certificate for those ones. And that you only would know how to obtain that one once you apply for your qualification. You are going to submit your documents. Then they are going to tell you, yes, you meet the requirements. This is an approved study. Or you have to complete either a bridging program for that one. It could be a 3 months, could be few units that you have to do, or they ask you to do a volunteer work in the program under a supervised practice. It could be completely different outcomes, which we cannot tell you in looking into your exams or your qualifications. So we have to apply to them. All these processes for these qualifications, if you don't know whether they are accredited or equivalent or not, and then the outcome letter would tell you what's next for this. All right. Okay, so now this is what I have covered a little bit about it, which is an ANMAC skills assessment, which is for the nurses, because while Deepa was talking about it, I could see there were few messages about the nurses. So I thought I will quickly add this one also. It is not part of it. Sorry, Deepa. Okay, so I'm talking about an ANMAC skills assessment, which is basically the nursing ones. And where it is, if you have got a qualification which is obtained not from Australia or overseas, and it is from a modified skills assessment. Basically, that's Canada, that's UK, US, and New Zealand and Ireland. Those qualifications, the registrations from there, if you're holding those ones, you can apply for here straight away for your registration leading to the skills assessment. So registration is mainly the purpose. If you have not done the registration, if you're not obtaining the qualification from there, then here you have to do a bridging program for 1 year, which leads to the skills assessment. And then those skills assessment gives you further to the residency pathways. Sometimes, for example, a pharmacist, they say that we have got a I can get my skills assessment as multiple. I can get a pharmacy as a technician skills assessment, as well as if I sit for my CAPS exam, or if my qualification is accredited, I can go for the pharmacist also, industrial pharmacist. as well as hospital pharmacist and a retail pharmacist. It's great. The more you have got a number of multiple skills assessment, the merrier it is. You can get an assessment on the grounds of your previous qualification, what you have obtained in your home country, or on the basis, and while doing that, you're also studying here, which is leading to a different qualification or a different skills assessment. If that's the case, try to get in both the things, because you don't know which invitation will come under what occupation at what points. This is having two lottery tickets. You can get maybe in both. You never know. Lucky enough, then, yes. So, and then we talk about the permanent residency pathway. Now, let's say we have done the right accredited qualification, or we were an overseas ones, or we have minimum required their exams. We have done those ones now, and we have obtained this full skills assessment. Then the next point is to lodge an expression of interest. When you have got a skills assessment and you lodge an expression of interest, you would be lodging an expression of interest for 3 different visas: 189, 190, and a 491. They all are points tested. Okay. You find an employer, you go through an employer registration pathway, that's completely different. But here I would be covering about how are you going to get your skills assessment, how you're going to get it through the invitation pathway. For a 189, what is the difference between all 3 visas? 189, 190, 491, all points based. Then what? 189, upon grant, it basically matters once the visa is granted, what is your conditions on it. 189 has got a nil condition. You can live and work anywhere in Australia, no questions asked. And this invitation rounds are held by federal government. During COVID time, health occupations overseas or onshore or offshore, they were invited as low points as 65. It was a great time for those health occupations. They were all invited at 65 points. And visas processing time is also very quick for the health professionals. So if you have got your EOIs and invited for 189, and I can tell you one of my applicant even got a visa in less than 9 days, right? So you can say that how badly department needs them. And 189 is a federal round. Then we talk about 190. That's a state sponsorship. You guys, if you're looking forward for a 190 state sponsorship, in this session, I'm not including about different states, what their requirements are, what they need to do, because we have got a specialized sessions for those ones and must attend. Because right now, it is a big question, which state should I live in? Where should I go? If I need to move, where should I move? So this is where you have got your skills assessment, then you need to be at the right place at the right time. So that's what an EOI is. So there is an invitation waiting for you, but you're sitting at the wrong state, which is not inviting at the moment, or you're sitting at a lower points, and that state has got quite competitive points for those ones. You need to move the state at that point, but making sure that you are meeting those state requirements. So 190 visa is again a state-sponsored invited program. Once granted, you have to live in the sponsored state for 2 years. It is an obligation for you to live in the state because state is giving you. Now 190, the points are generally lower as compared to a 189. Even in the previous rounds and invitations, I have seen most of the states, or even in fact every state, is prioritizing the health occupations. So if you've got those ones, your states should be inviting you, and do attend the special conclave sessions about different states. We have it. Everybody has done a lot of hard work in preparing and providing you all those information. So make sure you attend those ones. That will be an hour worth of your time. I can assure you for that. Then comes a 491 visa. I go back to the 190. So what's special in a 190 is that the state gives you 5 additional points in addition to a 189. So example, I have got my own points of a 90 or 65, And if I'm invited for a 190, the state will add 5 points for that. So I'll be sitting at 70 points, and my competition is with the 70 points for those ones. Okay. This is about a 190. And once a visa is granted, you are obliged to live in that state for 2 years. Let's talk about a 491. 491, this is basically 15 points from a regional area or 15 points from a relative. They can also give you 15 points, and then you will be granted a 491 visa. This is again invitation based. If state is inviting you, then you have to look into the state requirements for a 491. If relative is inviting you, then your relative must be living in a designated area the day you are being invited. And they must be an Australian citizen or a permanent resident, not provisional resident, must be permanent resident, and must be related to you as a brother or a first cousin. And these are the ones which are, or your spouse's brother or a first cousin. And you are also, then your spouse must also be a part of an application. Okay. So let's say, for example, my husband's brother is a permanent resident, then I can get the 15 points based on this, provided I'm keeping my husband in my application, which I will, though. Okay, so 491, it's the requirement is once you are granted a visa, you have to live and work in a regional area and in any regional area. For example, I have been granted a visa from New South Wales through the New South Wales state nomination. After living there for 1 year, I've got a job opportunity in WA. I wanted to move to the Western Australia. You are, because Western Australia is again a regional area. So the whole Australia is regional, except Melbourne, Sydney, and Brisbane metropolitan cities. If you're living in a 491 designated area of New South Wales and you move to South Australia, great, no questions asked. You have to live in it for 3 years out of 5 years in a regional area. And if you're working, all the work must be undertaken in a regional area. For example, you are in Western Australia. The whole Western Australia, including the metropolitan city, is regional. So it doesn't matter where you are working and living in the whole of WA. Entire WA is regional. You are in Melbourne. As I said, metropolitan area is not. So, and you're living in the designated area of Melbourne. Great, you're meeting the living requirement. But you're traveling to the metro and working there while holding your 491. Then you are breaching the condition. And after 3 years of holding that visa, when you will apply, then because you have breached the condition, you will be declined for your 191 visa. So make sure that you live and work in your regional area while holding this visa. And this will then no questions asked, and 191 will be granted. At the time of the 191 visa, you don't have to worry about my occupation is still in the list or not. Doesn't matter. You don't have to worry about do I need an invitation again? Do I need for sit for an English again? Do I need what if the rules changes? Doesn't matter. The rules or the legislation applicable at the time of the grant of the 491 will be reviewed and looked into at the time of your 191 visa application, which you are applying after 3 years of holding. If in any case, applicant is not able to apply for a 191 visa after 3 years, and then there's an extended pathway also, and we can talk about it in other sessions about it. But that is not something that it is an end of the world over there. All right. So let's say, so I wrap it around for this. You have studied accredited qualification, or you have got an overseas qualification, you met those requirements, the additional requirements, or you have sit for a test, you have got your English test, you got your full skills assessment along with the registration. Then you apply for expression of interest for all these 3 visas. Apply for all 3 and see your luck. And you have got multiple qualifications, then apply for all of those ones. I've got 2 skills assessment. That means I'll be applying for 6 COIs and will be waiting on those ones. Your chances would be higher. Once invited, you lodge your visa application and we take it up from there. All right. And so in a nutshell, The mandatory things for applying for your PR is your skills assessment, which is based on your qualification and or experience or overseas or current year. Minimum English requirement is 60, and you must have at least 65 points, including the state points. I've got a 50 points. 15 is given by 491. I'm eligible for only for a 491 visa, but for multiple assessments, I could be. All right. And this is my wrapping around. And thank you guys for listening me.
Preeti, it was a pleasure. That was a wonderful session. Thank you, Queena, and thank you, ma'am.
All right. Thank you, everybody, for listening.
Thank you.
Thank you, Deepa. Thank you, Preeti.